Good morning. Our video clip is on cosmetic procedures and women. More women than men have cosmetic procedures performed, and there are 4 common procedures. But with each one of these, there are risks associated. So today we're going to talk about why so many women have cosmetic procedures performed, the 4 types of cosmetic procedures that are most commonly performed, and the associated risks with each procedure performed. Let's get started.
So why do so many women get cosmetic surgeries? There are numerous reasons. Bad genes for one. Career boost. They would like to boost up their career, so they want the big breasts and the big booties so they can have an awesome career. And to look like their famous favorite celebrity. I, for one, would like to have a Nicki Minaj butt.
We may not have friends like Nicki Minaj, but there are 4 procedures that many people have to make themselves look better and feel better about themselves. The first cosmetic surgery that people have, liposuction. Liposuction takes away the fatty deposits that accumulate around the hip and the thigh area. Easily done in a hospital environment, and it's done so it contours the body so you don't have excess fatty tissue around the hip and thigh area. The next one we're going to talk about are breast implants. Now, breast implants can either be saline or they can be silicone. Breast implants are put in underneath the breast, or you can go in through the armpit and under the pectoral muscle so that there's no visible scar. Many women do this to proportion their body or feel better about themselves. Another one that we're going to talk about is the tummy tuck, which is the abdominoplasty. Both men and women have this done too. Have a little excess baggage around the stomach area. That's where you've gained weight, lost it, you've been pregnant, you want to get rid of it, you don't feel like working out on the exercise equipment. Well, you can go have a tummy tuck and it'll take care of it. And the last one that we're going to talk about are derma fillers. Derma fillers are around the face where you see the frown lines. This is for men and women. Also, you can do injectables around the lips. You have thin lips, and as we age, our skin of our face, our contour gets thinner. We can plump it back up. We can also plump these lips back up too. Well, now that we've talked about the 4 different procedures of cosmetic surgery, let's talk about the risks.
With all medical procedures, there are risks, and cosmetic surgery is no different. The risks for breast augmentation are anesthesia risk, bleeding, infection, changes in nipple or breast sensation, poor scarring of the skin, wrong or faulty placement of the implant, implant leakage or rupture, the formation of tight scars around the implant, fluid accumulation, wrinkling of the skin around the implant, pain which may persist, and the possibility of revisional surgery. For Botox, bruising and pain at the injection site, flu-like symptoms, headache, nausea, redness, temporary facial weakness, or drooping. Very rarely, the toxin can spread from the treatment area, which can cause botulism-like signs and symptoms such as breathing problems, trouble swallowing, muscle weakness, and slurred speech. For liposuction, anesthesia risk, bruising, change in skin sensation that may persist, damage to deeper structures such as nerves, blood vessels, muscles, lungs, and abdominal organs, deep vein thrombosis, cardiac and pulmonary complications, fluid accumulation, infection, irregular contours and asymmetries, irregular pigmentation, need for revision surgery, persistent swelling, poor wound healing, rippling or loose skin, worsening of cellulite, swelling, thermal burn or heat injury from ultrasound with the ultrasound-assisted lipoplasty technique. For tummy tuck, anesthesia risk, bleeding, infection, fluid accumulation, poor wound healing, skin loss, numbness and other changes in skin sensation, skin discoloration and or prolonged swelling, unfavorable scarring, recurrent looseness of skin, fatty tissue found deep in the skin might die, deep vein thrombosis, cardiac and pulmonary complications, asymmetry, suboptimal aesthetic result, possibility of revisional surgery, persistent pain.
In conclusion, over 12 billion Americans had cosmetic surgery in 2013. According to RealSelf.com, 96% were very happy with their tummy tucks. 94% were very happy with their breast augmentation. 76% were very happy with their liposuction. And 68% were happy that they did the injectables. As we stated before, more women than men have cosmetic procedures performed, and there are 4 common cosmetic procedures performed. All have risks associated with them. So if you decide that you're going to have cosmetic surgery, make sure that you do your investigation. Decide what type that you want, and make sure that you do your investigation on the physician that's doing it. We hope that we have shed some light on this informative information, and you've enjoyed our video. Have a great day.